Who are you?
I am Katherine Feldman, the State Public Health Veterinarian with the Maryland Department of Health and Mental Hygiene.
Katherine?
Lyme disease is a bacterial infection and it's transmitted by a tick. It is the most common tick-borne disease in Maryland and in the United States. 3 to 30 days after a tick bite, someone infected with Lyme disease might experience a gradually expanding rash that can grow up to 12 inches in diameter. Now, not everyone gets that rash. Probably only 70% of people will experience a rash like that. But you might also experience things like headache, fever, fatigue. Folks who do not experience the rash, or even if you have the rash but it's left untreated, might go on then to experience joint involvement, such as arthritis or cardiac system problems, or even neurologic system problems. Lyme disease is a tick-borne disease, which means that it is transmitted through the bite of an infected tick. The tick that is involved in Lyme disease transmission is called the black-legged tick. Some folks call it the deer tick. And there are two very important things to know about the tick. One is that it has several stages in its life cycle, and the stage that is most commonly involved in transmitting Lyme disease is extremely small, and it can be very difficult to detect. Some people say it looks like a moving freckle. It can be the size of a poppy seed. The other very important thing to know about the tick transmission is that the tick has to be attached to your body for at least 24 hours before it can transmit Lyme disease. So our best prevention for Lyme disease is to get ticks off of you as soon as you come in from the outdoors. Lyme disease will often start with a gradually expanding rash in around 3/4 of the people who have Lyme disease. And if someone goes to see their healthcare provider and the healthcare provider recognizes the rash, that's all that is needed to make a diagnosis of Lyme disease. In fact, it's recommended not to test with blood tests at the early stage of the disease because your body might not have made the antibodies, which are what is measured in the blood tests. Now, when patients present with later stages of the disease, your healthcare provider might draw blood so they can do a blood test for Lyme disease. Lyme disease is a bacterial infection, and bacterial infections can be treated with antibiotics. So most people who are treated early in the course of their illness and with the right antibiotic need only take 2 to 4 weeks of antibiotics for a complete and rapid recovery. Now, some patients might have some of the later problems, like I described with neurologic and cardiac symptoms, and those patients might need intravenous antibiotics. There have been several clinical trials looking at long-term antibiotic usage and its benefits for Lyme disease patients, and there have been no benefits associated with long-term antibiotic usage. In fact, there can be some side effects, some of those severe, even as severe as death. And this can also contribute to antimicrobial resistance in the community. The Infectious Diseases Society of America has published established scientific-based guidelines, and those can be accessed off the CDC website, www.cdc.gov. The key to preventing Lyme disease is, first off, to keep the ticks off of you, and then secondly, if they get on you, to get them off in a timely fashion. So to keep ticks off of you in the first place, use repellent, and use it according to the manufacturer's label. Also, avoid areas where ticks like to be. We want to encourage people to enjoy the outdoors, but we want them to be safe when they're doing it. So if you're going for a hike, walk in the middle of the trail and avoid the brushy areas that ticks like to live in. Ticks need moisture, so they like leaf litter. They like the brushy edge where lawn meets brush and trees. So if you can avoid those areas, that will help to keep ticks off of you. Now, Lyme disease requires at least 24 hours to be transmitted after a tick attaches to you. So the single best thing you can do to prevent Lyme disease is, once you're inside, after being outdoors in tick habitat, do a head-to-toe body check for ticks. Remember, the tick that transmits Lyme disease is very small, so you have to be extremely thorough in looking for the ticks on you. The other thing that is very helpful is to take a shower immediately after coming inside, because that will help you look for ticks as well as possibly washing away ticks that are not yet attached.
Remove it.
If you have a tick attached to your skin, do not panic. get some fine-tipped tweezers and get as close to your skin as possible while grasping the outside of the tick and pull gently and steadily away from your skin. You can't be shy. You need to pull firmly and gently to get that tick off of you. Once it's off, wash the area thoroughly with soap and water or a disinfectant. I always recommend taping the tick then to an index card or a piece of white paper, and that way you can take the tick to a healthcare provider or get it identified so you know what kind of tick was attached to you. In Maryland, we get several thousand reports of Lyme disease that we investigate each year. And we know that some areas of Maryland have a higher incidence of Lyme disease than others. So for instance, the very westernmost counties don't have too much Lyme disease. But what I really want people to pay attention to is that there's Lyme disease throughout the state. And so we need people to take the proper precautions to keep ticks off of you and to get them off of you in a timely fashion. In Maryland, we routinely collect reports of Lyme disease, and we can analyze that to look at where the hot spots are and who's getting affected. We can then deliver educational messages to both the public and to healthcare providers to aid in the prevention of tick bites and in the early diagnosis of the disease. We're also actively involved in several studies trying to determine the best approaches for the prevention and control of Lyme disease. That you can learn more about Lyme disease, especially in Maryland. One is our State Health Department's website, www.dhmh.maryland.gov, and the other is the Centers for Disease Control and Prevention's website, www.cdc.gov.